Now this morning's health check. Sometimes dandruff can be a sign of a much more serious skin condition. Dermatologists, one that we're talking to, is seeing an increase in patients suffering from seborrheic dermatitis. I'm not even sure what that is, and I don't know if you do either, but let's talk with the doctor about it. We'll have more on the condition right now and why it tends to flare up at this time of year. Dermatologist Dr. Sherry Ingraham, thank you so much for coming in today.
Thank you for having me.
These are those little things that really are important to taking care of our skin, but maybe we're so busy we don't have time to go into the doctor. Talk about what this is to begin with.
So seborrheic dermatitis is, like we were talking about, on the spectrum with dandruff. So dandruff is a flaky scalp. Sebderm is when it becomes more inflamed and more flaky, and patients often think, I have dry scalp. My scalp is flaking because it's dry, but it's actually the converse. It's flaky because it's inflamed, and we perceive it to be dry because it's scaling, but it's actually inflammation causing that scaling.
When patients come to see you with this, have they kind of self-diagnosed? Do they think they already know what it is?
You know, I think they've been living with it for years, or all of a sudden it started. They've tried some over-the-counter dandruff shampoos, and by the time they come to us, it's not really working. And there are patients who get it in other hair-bearing areas. So a lot of times you'll see men with it in the beard area, in the ears, even on the chest or the back. It can be very debilitating because it gets on your clothes, you're embarrassed at work, and it can also be very itchy. So people are up all night long scratching their scalps, but there are things we can do to make this better.
That sounds uncomfortable. Talk about treatment.
So treatment options begin with over-the-counter. We like the Purifion Zinc or the Selenium Sulfide, which is Head and Shoulders or Selsun Blue to start. There's also over-the-counter ketoconazole shampoo and other products that say for seborrheic dermatitis. When those aren't working though, you need to think about changing your diet. So you want to get more essential fatty acids in your diet. You know, you hear about omega-3s, omega-6s. You know, our classic Western diet has too many omega-6 fats, which are inflammatory. So you need to eat more essential fats that are anti-inflammatory: salmon, walnuts, flax seeds, ground flax seeds. And then if those things aren't working, you need to see a dermatologist. And it's amazing to me how many patients come in for other conditions, a skin cancer check, maybe they have eczema, but they also have seborrheic dermatitis. It's very, very ubiquitous, and this time of the year, it's really flaring up.
Thank you so much. I know those photos are never pleasant to show, but if you're feeling that, a dermatologist can help you. All right, thanks so much for coming in.